Over the past 30 years of practice, every patient I see, I know there's a difference.
You know, the eyes are a window to the body, and we spend a lot of time taking care of that every day. And occasionally you're lucky enough to step in the way of something that could be life-threatening, and that's a powerful thing, to be able to provide that level of care.
I actually had a patient about 2 years ago now who we saw in the office who had lost vision quite quickly. We did her eye exam, looked inside, and we actually found that her blood vessels were very dilated, a lot of bleeding, things like that. I sent her to an urgent care and had them check her blood pressure to see if anything was wrong. And she came back and said that they told her she was completely fine. So we went and sent her to another doctor who found out she had leukemia. And she actually, after that, she recovered from it. She's in remission, has been for the last 2 years. She actually stopped my husband in a grocery store and said, "Your wife saved my life." So that was a pretty cool story.
I had a patient about 6 months ago, a 48-year-old patient, otherwise healthy. He had an unremarkable eye exam, but he allowed us to do a Optomap of his retina. And when we were doing the Optomap, we found a very tiny blockage in one of the arteries of the retina. And I sent him to his primary care doctor the same day for an ultrasound of his carotid, and they found 98% blockage of his carotid artery. And the next day, he had an endarterectomy, which is a surgery to open the carotid artery. You know, that could have been a stroke ready to happen, and we found it just because of the ability to detail the back of the eye.
Every patient that I see, I really do feel is a unique experience, and I can make a difference in that person's life by enhancing their vision so that they can stay independent in life.